Hi, my name is Dr. Fred Sylvester from New Hanover Chiropractic, and welcome to this episode of Health Talk. Again, we're coming with conditions, and Dr. Karen, senior clinician, been with us 20-some years plus, is here to show us some exercises and some conditions about the shoulder, specifically impingement syndrome.
Yes.
No further ado, here you go.
All right, so the shoulder is a complex joint. In school, we were taught that it was a showstopper. It's a joint that, if it's not taken care of properly, can turn into bigger, deeper problems.
Okay.
So it starts a lot with posture. There are traumas that can happen where people have shoulder tears, but more often than not, the shoulder impingement comes from repetitive motions, poor posture, or the straw that broke the camel's back. People can't really point to one incident that created the pain.
Sure.
So the shoulder should always be set back into proper posture, which means back and down a little bit. And again, in today's society, we tend to round our shoulders forward. When we bring our shoulders forward, it's going to change the dynamics of how the shoulder moves and what the muscles are doing there. So a good exercise, or a quick example of how I like to demonstrate this, is if your shoulders are pulled back and up, or down, sorry, back and down, and you're gonna bring that arm up as far as you can go. You can usually go up if you have a healthy shoulder.
Sure.
Now if you round your shoulders forward and try to lift that arm up as high as you can go,
I'm stopping right
yeah,
about there.
you can't get there. So it changes the dynamics of how those muscles work, and that's gonna set you up for failure or injury in the shoulder.
And how many people do you think have that upper cross syndrome where the shoulders are rounding? I mean, you know,
100% of the world.
I mean, so when we kind of look at phones and we look at computers and that type of stuff, naturally everybody's kind of sitting here forward into the middle of us, correct?
Yes, I usually tell patients the only ones that I think that maybe don't have that posture would be like yoga instructors who are constantly
Dancers,
focusing,
yeah, up and back.
on their posture. So I want to talk about a few exercises that we can do to loosen up that shoulder and help retrain it to sit back in its position.
Sure.
So first and foremost, when you're having pain in the shoulder, it's the impingement. What happens there? I'm going to bring in my model. So the shoulder blade sits here. It's made up of the rotator cuff muscles. There are, the shoulder's gonna fall out of place here. There are 4 muscles: the subscap, which sits up underneath the shoulder blade, the supraspinatus that sits on top, the infraspinatus, and the teres muscles that sit in the back. So there's 4 muscles there. What happens is with shoulder impingement is this muscle on top, the supraspinatus, can get pinched underneath your acromion when the
You're trying to move up
shoulder
and over.
is moving up into that joint.
Yeah.
So what we want to do is get that shoulder to loosen up. Not quite like this. This would be problematic. But we do want to have that shoulder drop down out of the joint a little bit and give it some space. So the first exercise I want to demonstrate is the pendulum swing.
Sure.
We have a weight right down there. that we're
I
gonna
wanted
use.
to use the 20-pound weight, but I've been reduced to the 3-pound weight.
Yes. So you're going to think of this like a child maybe swinging their elephant trunk with their arm. You want your arm to be completely loose and relaxed. So you're going to bend over, and that weight is there to help dangle it. You can do it like that. Sometimes I find that you might even get a little bit easier if you're just holding it by the end like this.
Okay. All right.
That way your arm's completely
Oh, very good.
loose,
Sure.
because we don't want you gripping and controlling the motion. So you're going to move your hips, and then that arm is going to swing. And that is pulling that shoulder down and letting it break up any adhesions and creating some movement in that joint.
So
And you
it's
go
not
ahead.
this, right?
No, yeah, you're not
I'm
moving. You're
I'm
using your
the-
body to get your arm to swing.
Okay.
And you're going to do this ideally for 60 seconds straight. We don't have to do that right here, right now, but you get the idea there.
58,
So-
59,
and
60.
60. Perfect. So that's the first one to start increasing some range of motion in that arm. The stretch for that muscle that we were just speaking of, the supraspinatus muscle, what that muscle does is pull the arm out and away from the body. So it's going to pull like that, out and away. So what we want to do to stretch it is bring it back in close to the body. So you're going to pull across the way Dr. Sylvester is here, and you're going to, you can even pull your ear or your head away from that as well to get a slightly deeper stretch into that muscle. And you're going to hold that for 20 to 30 seconds.
I always kind of look at this as being like the chicken wing exercise, where you kind of have this one coming out, and it just kind of gives you an idea of, we'll say, a point of reference of how you're supposed to do the stretch.
Yes. And then the next exercise that I'd like to do is the wall slides. So this is for, again, patients can't get their arm up above their heads. So what we like to use is the assist of the wall. So you're going to put your arm out on the wall, and we can do this in 2 planes of motion. This is abduction, coming up the wall, and you're going to come in close, and you're going to go as far as you can go comfortably to get that movement above the head, and again, start breaking down any adhesions and encourage a passive range of motion. The wall is really what's helping you to get that movement. You're not actively bringing that arm up. and the other one would be in a flexion position, so the arms out in front and you're coming up into that wall as far as you can go comfortably and hold there. Again, you're going to go to the point of pain, not beyond the point of pain.
Something I like to do with patients on this one here, just in case. So say, for instance, you get to this point here and it's really kind of cramping down on you. So this would be active motion. I like just to bend the knees slightly, and that would give you a little bit of passive. So you can get a little bit more into the motion pattern, even with just bending your knees as well.
Yes, I would agree with that. And same thing with the flexion. You
Yep.
can dip down a little bit with that to get that movement, or you can lean forward into it to get that movement. The last exercise, which is probably the most important in terms of resetting that scapula on your spine, is going to be the scap retraction,
Right.
is what we call it. So again, we talked about that. That's problematic with that arm. Again, we talked about
Surgery.
that shoulder plane, when the shoulder blade comes forward, that you can't bring that arm up.
Okay.
So what's very important is that we bring that shoulder blade back and down. And so I always tell patients with this one, it is a pinch back and down. You don't want to be shrugging your shoulders up towards your ears, which would be bad. So I'm going to have you demonstrate that real quick. You don't want to go shrug up. This is bad. You want to go back and pull down. One of two ways that I usually recommend that patients do this is think of putting your elbows in your back pockets.
Perfect.
So if you're trying to get the elbows into your back pockets, that is going to encourage that in towards the spine and downward movement. The last one would be if you're keeping your arms straight and you pinch straight back and down, is driving your fingertips towards the floor.
Head position matter or no?
Good posture is always important. So head up. Again, we want to keep that chin in check and good posture.
For sure.
So those are 4 great exercises to start alleviating some of that shoulder impingement pain. If that is not helping you, then I would encourage you to see a chiropractor.
Very well. Good day and good health.